Madam Chair, House members, thank you for coming, and staff, thank you for putting everything together. We are going to open up our conference committee. We called this committee for Senate Bill 34 and all other bills in conference. For those of you maybe listening online or in the audience that are not too sure what bills we're talking about outside of Senate Bill 34, House Bill 2540 is a bill that we conferenced on. It was originally House Bill 2262. It was the Controlled Substance Act. When it was in conference, it had an amendment that put on fentanyl strips as removing it as a drug paraphernalia. It went to the Senate floor. The Senate floor rejected that amendment, wanted to send it back and have that removed. So that will be something we will be discussing. Other bill, Senate Bill 19, which is the 988 suicide hotline bill. For those of you like me that have slept a couple of times since our last meeting, we did have a few discussions and came to, I think, pretty much an agreement. Do we have that paperwork ready that we could at least hand out for those that are in the audience that might want to look at it? Or
I did not, Senator, I did not ask for copies. I was just going to have staff hit those bullet points of changes that we agreed upon the last time this conference committee.
Okay. Staff, if you would go ahead and we're going to briefly, we're not going to take any action on any of the bills. Senate Bill 34 will be the first bill that we will discuss or take action on, but we want to discuss these, get this discussion part out of the way, and then that way we can get everything hopefully wrapped up in this conference committee. So staff, if you could just give us a refresher on Senate Bill 19.
Thank you, Mr. Chair. This is Jen Moyer with the Office of Revisor Statutes and Senate Bill 19 as it was in conference. I'll just briefly go over the changes that were agreed to. The first change is on page 3 in line 16, and it would change funding any uninsured services to funding payment for crisis stabilization services provided to an individual in direct response to a hotline center call if such individual is uninsured or such services are not covered by that individual's insurance. It would also make a change on page, let's see, it's section 5, page 5, and it would add a new subsection C2 that monies credited to the fund shall not be used to pay expenses attributed to persons or entities domiciled outside the state. It also clarified an additional change on in section 8, page 6, to change the number of the council members from 15 to 11 with 9 voting members. And additionally, on page 7, it would be lines 11 and 13. This conference committee agreed to keep the number of the population in those clauses 9 and 10 to be 200 or to be 75,000 instead of the 200,000. And to additionally keep that member of the Mid-America Regional Council. And the last change agreed to by this committee was in section 8. On page 8 would add a subsection H that would sunset the bill on July 1, 2026. And I believe that covers all of the agreements that were made. And so if the committee would agree, we could begin drafting the conference committee report.
Does anybody have any questions on any of that? Or you guys, it sounds awfully familiar. Going through on my notes, that's what I have.
Yeah, those were Senate changes that were recommended and we accepted the last time we met, so we're good. And then I would also ask that if there's any little technicals, because I think there's some technical language changes that they're trying to make as they go into the statutes, that we allow our revisers to do that as well.
Madam Chair, I think that is all that we have on Senate Bill 19. If there's anything else.
Start with preparing the conference, the CCR.
Yeah, I think she can go ahead and start preparing it.
Right.
Are you okay discussing 2054 while we're waiting on the paperwork for 34?
2054? 2540.
2540, that is correct, yes, sorry. Too many numbers.
Yes, sir.
Okay. Since it's a House bill, I'll let you take the lead.
Well, and on that one, Mr. Chairman, as much as we're not happy with the idea of removing the fentanyl strips, I think people misunderstand. I understand there was comments made that this would just, encourage people to do more with drugs. Maybe they related it to needle programs that are done in parks and stuff across the country. That's nothing like this, because I've never been a supporter of the needle program. Fentanyl is unfortunately killing a lot of individuals because they take something they don't know is laced with it. But I understand that the Senate had strong opposition to it. I'm not quite sure why we aren't more concerned about people dying, but apparently we're not. So at this time here, we would allow that to be removed. I will ask that the pharmacy folks get in contact with the pharmacy board. I did speak to her this morning and asked her to maybe get with different counterparts and different people between now and next session so that we can take a stronger look at this. I did have conversation with law enforcement, and they weren't having a problem with it, or our healthcare providers, because they did see the lives that were being saved. So, but we'll remove it at this point.
And I think, on our side, I think that's the only thing that we wanted to see change. So
Okay.
I think we could move ahead on that report on that one as well. I see some paperwork came in. Is that on 34? Okay.
That's it on 2540.
Okay. Sounds good. All right, we'll turn our attention back to Senate Bill 34. If staff could hand out the paperwork.
So this will be our last one, correct, Mr. Chairman?
Unless you'd like to do 2280.
No. Not at this time. Seeing as this is your bill, I'll let you explain, Mr. Chairman.
Madam Chair, I do appreciate that. Senate Bill 34 was referred to us. It was originally a rules and regs bill in Fed and state. The contents of that was passed in another bill, so it's a shell. What the Senate position was, our offer, or what we were going to offer, was to put in contents of 541 and the contents of 489 into Senate Bill 34. We have reached out to interested parties, and I think we've came up to an agreement to use the best parts that we feel out of those two bills and condensed it down. And that is what this RS 46001 is. So basically, for those listening online, and I think hopefully everybody in the audience has a copy, it would put in effect where no government entity or public official, elected official could pass or require an individual to wear a face mask as a response to contagious or infectious disease. But I tell you what, instead of me doing this highlight, I think our staff does a heck of a lot better job than I will do. So if it's okay with everybody, we'll let them do that part.
Thank you, Mr. Chair. Again, Jenna Moyer, Reviser of Statutes Office. We'll just start with Section 1, specifies that no governmental entity or public official can require a face mask. However, they may recommend a face mask, and we added a subsection C that the provisions of this would not apply to a governmental entity that's a medical care facility, and that definition, 65-425, includes hospitals, surgical centers, and recuperation centers. And new Section 2 would specify that no governmental entity or public official shall issue a COVID vaccine passport without consent or require use of that passport for any purpose or deny housing, refuse access to public spaces, or separate individuals based on their vaccination status, specifying that screening protocols are allowed. And this is the language from last year's budget proviso, and it is expanded. Last year in the budget proviso, you may remember it was limited to state agencies, and this would expand it to governmental entities, so it would include local units of government as well as those public officials. And it would add those definitions, and again, would not apply to a governmental entity that's that medical care facility in KSA 65-425. Section 3 would amend KSA 48-925, which is in KEMA, in subsection D, that the governor shall not have the authority under KEMA or any other law to require face mask as a response to a contagious or infectious disease, and this is on page 5. And it also adds in subsection G1, which is related to civil actions challenging executive orders that are issued under this subsection. And it changes that requirement for the court order to issue a final order on the petition from 7 days to issuing that order without unreasonable delay, and then deletes that last sentence that would, if the order were not issued within 7 days, that the relief would be granted to the petitioner. So it strikes that. And the next change in Section 4, it amends KSA 48-932, and this would be on page 8, that and this is a statute, and this is a statute specifically applicable to local units of government, but adds in subsection E1, page 8, that a governmental entity or public official would not have the power under KEMA or any other law or otherwise to require any individual to wear a face mask as a response to a contagious or infectious disease. Again, limiting it to not apply to medical care facilities, and making that same change related to a party aggrieved by an action taken by a local government, that final order on the petition, changing it from 7 days to without unreasonable delay. And the next change would be in Section 5, amending KSA 65-129B, and it strikes the provision that would have allowed the KDHE secretary to order the sheriff to assist in the execution or enforcement of any order under this section, which would be powers related to seeking, requiring individuals to seek evaluation and treatment or isolation and quarantine. So the sheriffs could not be ordered by the Secretary of KDHE to enforce a quarantine order or requiring treatment for individuals exposed to infectious or contagious diseases. Let's see, Section 6 amends KSA 65-201, specific to local health officers not being able to issue the wearing of face masks. And that is on page 11 in subsection B2. And again, there's that change about the court petition order being issued within 7 days being changed to that unreasonable delay. And Section 7 amends KSA 7262, which allows tests or inoculations to be required to attend a school. And this would specify that a test or inoculation cannot be deemed necessary by the secretary unless it has received full approval by the Food and Drug Administration for the age of student that is required to receive that test or inoculation. And it makes we changed essentially the word pupil to student as that's current drafting practice. So some of those technical amendments as well. I'll be happy to answer any questions.
Jenna, thank you. Do we have any questions on this proposal? Senator Gossage.
Not a question, Mr. Chair, just a comment. I serve on the Judiciary Committee as well as the Health Committee, and this originally came to us in the Judiciary Committee, and we passed it out.
Any other comments or questions? Senator Petty.
Thank you, Mr. Chairman. Jenna, as I'm looking at the proposed language changes for SB 34, when it talks about the, in the last section about vaccines or in KS 72-6262, is this so it's, excuse me, it's pertaining specifically that line 2 on page 13, or number 2 on page 13, is, it says not fully approved by the Federal Food and Drug Administration for the age of the student to whom the requirement. So when it comes to vaccines and inoculations, this is the one section that's dealing specifically with that?
Mr. Chair, Senator Petty, this is the section of statute that deals with those requirements for schools. There is another section that deals specifically with daycare facilities, which is not included in here. It does mention daycares that are run or preschools that are operated by a school, but there is a separate section of law that deals specifically with daycare facilities that is not included as part of this draft.
And so there's, okay, so there's no other section, there's no other changes specifically to vaccinations than within this, what we currently have in front of us?
Thank you, Mr. Chair, Senator Petty. There are not. The only, this is the only change other than changing the word pupil to student would be that any test or vaccination required by the secretary to attend school would have to be FDA approved.
Thank you.
Representative Epley.
Representative Epley.
Madam Chair.
Thank you, Chairman, Chairmans. I just want to ask a question on the clarifying from current language on the inoculation provision that you just outlined, Jenna. How's the wording different than the current law? I mean, does it not specify whether it's FDA approved or not? Current statute does not. Okay, and then my other question is I would assume, just assume that emergency use authorization, EUA, is not full approval, and so that you would not allow that to go forward.
Thank you, Madam Chair. Representative Epley, that is what is contemplated. It is not that specific wording is not in here, but that is what is
Implied.
implied, yes.
Then I have one last question, Madam Chair, Mr. Chair. Okay, and that would be back on the first section. That's not just COVID-19 vaccinations, that's all infectious diseases, is that correct? All respiratory infectious disease, including tuberculosis, including streptococcus, including pneumococcus. You can't require people to wear face masks in certain situations from a governmental entity standpoint for the wide array of respiratory acquired illness, is that correct?
Well, not just, thank you, Madam Chair, Representative Epley. it would be for any contagious or infectious disease, not just limited to COVID-19. So it would, no matter what the disease is, no government at any level of Kansas could require face masks.
And one last question, if I may, Mr. Chair, Madam Chair. And that is this patterned, or are there other states that have done this already? Do we have any template or ideas that this has been done elsewhere?
I can only speak for the drafting that was done in our office. We did not look to other states' laws or proposed legislation to draft this.
What about research? Do they have any information for us on this subject? I'm done.
Okay.
Madam Chair, Representative, in research we've done, we have not looked into what other states are doing with regard to masks for all diseases.
Thank you. Thank you very much.
Madam Chair, I do believe that would be our Senate offer, if the House would be agreeable to it.
I believe Representative Reese has some questions, Mr. Chairman.
Thank you, Madam Chair. On that page 1 and just the top brief of the bill itself, I'm really concerned about this, the whole thing about the restricting the power of the Secretary of Health and Environment. I understand, you know, having to order law enforcement to assist in those executions. Does this pertain only to wearing a mask, or does this mean that if we have an outbreak of TB, that the secretary cannot enforce anything else with that, for like the quarantines or the isolation, inoculation, or any kind of vaccines that might be needed for that?
Thank you, Madam Chair. It is not just limited to COVID-19, but this would mean that no matter what the infectious or contagious disease, the Secretary would not be able to order any sheriff or other law enforcement to assist in the enforcement of any order issued under this section. And that would mainly be isolation and quarantine for both adults and children, as well as requiring an individual who the Secretary has reason to believe has been exposed to one of those diseases to seek treatment and evaluation.
You have another question? What kind of discussion was made with physicians regarding this, and with the Secretary of Health and Environment?
Physicians or Secretary of Zero. I will tell you where that discussion comes from. Discussing it with law enforcement, they do not want to be put in that position. They do not know what they're going into, and you're going to request a law enforcement. You're going to give the Secretary of Health the ability to mandate law enforcement go to somebody's house if they have no idea what they have. They don't have hazmat or whatever they're walking into. You're putting them into a dangerous position. And I will only say, and I don't say this lightly, and it's not meant to be taken lightly, but look what's happening in Shanghai. I do not think our state of Kansas should have the ability to do the same thing. That's what's happening to those poor people in Shanghai, and this would do that.
It's been occurring, hasn't it not been occurring now, where law enforcement has been assisting?
No,
Not in Kansas?
no. Senator Petty.
Thank you, Mr. Chairman, and that would be my point. Our law enforcement is included in in the current law, but they have not been asked to do that, and they have not had to do that. And I have to say I'm somewhat offended to be compared to Shanghai, because one, what has been going on in China has been totally different than what's been going on in Kansas in the last 2 years. So it's a very, very far reach. And we aren't the same type of government. We're democracy.
Any other comments or discussion?
Give us a moment. Mr. Chairman, my colleagues have kind of, expressed some concerns, and, I think there's a little bit concern of what happens with different, breakouts. It's like we just had a TB breakout. And if you've never dealt with TB, that's pretty ugly. So this would not protect other individuals. And there's also concerns that nursing homes aren't exempt in this like the hospitals. So although my members are not happy with this bill, we also understand it's what's needed to move some other things, so at this time we'll agree to sign it.
Very, very good. So we are in agreement, maybe begrudgingly, but we are in agreement for a conference committee report to be signed on Senate Bill 34. Do we have anything else that we need to address before we adjourn?
I think we just had, and we'll just reiterate it, Senate Bill 34, 2540, and Senate Bill 19 are the three conference committee reports we're signing today.
That is correct.
Is that right? They have to keep, I always look at them because they keep me on the straight and narrow. So I want to thank you, Mr. Chairman, and your members for your work this session. It hasn't been easy for any of us, but it never is. But I think we've done some pretty good things here. And of course, I'm very, very excited to see the movement on 988.
Madam Chair, I think we share the same sentiment, and especially to our staff as well. They've worked probably harder than we have, and we do appreciate it. I've said it many times, and I'll keep saying it. If it wasn't for them, nothing would get done up here, because if it was left up to people like me, we'd forget about it or misplace it. So thank you very much, and thank you, everybody, for being here and listening in. We are adjourned. Thank you.